Welcome to this video, which is part of a series of trainings offered by the Midwest Center for School Mental Health. Our series offers guidance for developing and implementing effective school-based mental health systems. My name is Dr. Cheryl Holm-Hansen, and I serve as co-director of the Midwest Center. This training focuses on the topic of equity in school-based mental health. While equity considerations are infused across all of our recorded trainings, we also thought it would be important to review some of these tips and strategies all together in one place. I want to start by providing some context regarding the role of school-based mental health. Nationally, 1 in 5 children and adolescents are estimated to have a diagnosable mental health disorder, such as depression, anxiety, or attention deficit disorder. Many communities have seen increases in recent years in the number of children or youth describing feelings of sadness, hopelessness, and stress. There can also be significant differences in who accesses services. Some youth are less likely to receive mental health care due to geographic barriers, financial barriers, stigma, a lack of culturally appropriate services, a lack of culturally responsive screening and referral processes, and other factors. Children and youth receive mental health care in schools more frequently than in any other setting, including doctor's offices or mental health clinics. Access to high-quality school-based services can help improve student mental health and academic success, while also improving school climate and safety. As a result, schools are uniquely poised to close gaps in access for historically underserved populations, such as youth who identify as Black, Indigenous, or people of color, or as lesbian, gay, bisexual, or transgender. Achieving these results will require specific focus, however. This video will outline some key considerations in developing and implementing equitable school-based mental health services. Before we get into these recommendations, I want to first talk about a few overarching frameworks that provide a context for this work. The first guiding framework is the Comprehensive School Mental Health Model, developed by the National Center for School Mental Health and the Mental Health Technology Transfer Center Network. Comprehensive school mental health systems provide a full array of supports and services that promote positive school climate, social emotional learning, mental health, and well-being. There's a lot that we could say about this framework, but we're going to keep it brief here. As it relates to equity, there are a few particular elements of this framework to highlight. First, comprehensive school mental health systems are built on a strong foundation of district and school professionals, including administrators and educators, specialized instructional support personnel, such as school psychologists, school social workers, school counselors, nurses, and other professionals, in strategic partnership with students, families, and community health and mental health partners. With so many people involved, there are lots of ways that team processes and student interactions can be set up to promote equity or to perpetuate systems of oppression. As we think about equity promotion, we need to think holistically about all of the professionals and partners that are involved and how we are building individual capacity, such as identifying and reducing implicit bias, while also creating a collective understanding of how we are working to move the system towards equity. Second, effective comprehensive school mental health systems contribute to improved student and school outcomes, including greater academic success, reduced exclusionary discipline practices, improved school climate and safety, and enhanced student social, emotional, and behavioral functioning. These are outcomes that will make a tremendous difference in the lives of students. Third, comprehensive school-based mental health systems involve providing several different kinds of services and supports. These services are provided at multiple levels or tiers. Tier 1 services refer to universal strategies that can be used to promote mental well-being of all students and to build healthy school climates. Tier 2 services refer to early intervention offered to students who may have emerging concerns or who may be at risk of developing concerns. Tier 3 services refer to more intensive interventions offered to students with identified mental health needs. As we think about equity within this system, we need to consider how cultural considerations are embedded into services at each level. We also need to determine how we are identifying students and connecting them with these services and ensuring that we have an inclusive and culturally grounded strategy for understanding what students really need and connecting them to the right kinds of services. Fourth, In addition to these direct services, a comprehensive school-based mental health framework requires an infrastructure for supporting school-based mental health. This infrastructure includes several core elements. Teaming addresses the need for multidisciplinary approaches to design and implement mental health services. Needs assessment and resource mapping are used to identify the most pressing mental health needs of students and available school or community services that could address these needs. Screening is used to proactively identify and refer students who may benefit from mental health supports. Funding and sustainability strategies are also integrated into the system to ensure that needed services can be provided and sustained over time. And finally, a comprehensive school mental health system should include a strategy for measuring the impact of services and using impact information to continuously strengthen services, inform policies, and change systems. The bottom line here is that equity promotion does not just involve student-facing elements, like the specific services that are being offered. Instead, equity must be infused throughout the infrastructure, including team processes, data collection efforts, and funding strategies. One helpful framework for thinking about that is the culturally responsive, anti-racist, and equitable or CARE schools model. In a culturally responsive school, students, families, and educators' cultural references are included in all aspects of schooling, including supports and services that promote well-being and mental health. Policies and practices promote equity and oppose racism and other forms of oppression. Equitable schools provide the climate and resources that enable all students and educators to perform at their highest level. Culturally responsive and equitable schools embrace cultural differences and assets, use cultural knowledge to promote wellness and academic success, mediate power imbalances based on cultural identities, and work to dismantle systems of injustice. There are three distinct elements of this model. First, effective school mental health systems should incorporate cultural responsiveness, ensuring that supports and services reflect the cultural beliefs and values of students, families, and educators. Second, school-based mental health systems should actively and intentionally oppose racism and other forms of oppression. And third, school-based mental health systems should be used in service of equity, ensuring that every student has what they need to achieve academically and experience positive well-being. These values cut across all aspects of the comprehensive mental health system. The recommendations that follow were informed by each of these frameworks in different ways. In this video, I'm going to provide quite a few different recommendations for things to consider in building an equitable school-based mental health system. These recommendations were developed based on these guiding frameworks, emerging best practice guidance, and input from stakeholders. In particular, I would like to acknowledge the role of the Minnesota Department of Education's Equity, Diversity, and Inclusion Center for their role in reviewing and shaping recommendations. As we move through these recommendations, it's going to sound like a lot of things to do, and it is. However, these recommendations are still just entry points into working towards cultural responsiveness, anti-racism, and equity. These constructs are all complicated and multifaceted. How these recommendations apply to any one school or district will also vary, depending on the makeup of your student body, available community resources, existing equity promotion efforts, and other factors. My goal in these recommendations is just to give you some ideas about how equity intersects with your school-based mental health work and some guidance for getting started. As I move through this review, I suggest that you pause for reflection. What recommendations resonate with you most? Which feel like they would have the greatest benefits for students? How do they align with what you are hearing directly from students and parents? Which may be the best entry points for ongoing work in this area? While I'm going to cover quite a few tips today, they fall broadly into 6 general categories. First, build effective and inclusive school mental health teams, including youth, parents, and community members. Number 2, create universal and culturally responsive systems of support for students. Number 3, provide mental health supports that are accessible, culturally responsive, and aligned with the needs of students. Number 4, build the knowledge, skills, and capacity of all school staff to advance equity. Number 5, collect appropriate and inclusive information about student mental health needs and services, and use that information to support equity promotion efforts. And number 6, build authentic community partnerships. The Comprehensive School Mental Health Framework emphasizes the use of school mental health teams. A school mental health team is defined as a team of school and community stakeholders at a school or district level that meets regularly, uses data-based decision-making, and relies on action planning to support student mental health. Teams may have a school or a district level focus. Their roles vary depending on which level they are at, but they typically play important roles related to prioritizing student needs, developing strategies to gather information from students or others, developing service approaches, and referring students for services. The team will carry a fair amount of institutional power, as their work can serve to either move towards greater cultural sensitivity and equity, or to perpetuate systems and structures that lead to disparities and oppression. Given the importance of these roles, it is critical to think about how to align the work of the team with equity promotion. As will be the case in the other sections of this video as well, there's a lot that we could say about creating effective and inclusive school mental health teams. We're going to focus on 4 primary recommendations to get started. Because it is critical to ensure that multiple perspectives about school mental health are integrated into planning and implementation, our first recommendation is to ensure diverse representation on your school mental health team. Membership in the school mental health team may vary, depending on whether the team is focused on school or district level issues. However, the team should include a diverse array of school staff. Typical staff member representatives include teachers, administrators, school-based health staff, and other school behavioral health staff, such as school psychologists, counselors, or nurses. In addition to these team members, there may be other school staff who are uniquely positioned to understand and support students. For example, you may want to include English language learning educators, special education staff, family advocate representatives, or cultural education staff. Your team should not be limited to school staff, however. It is important to include students and parents on the team so that these perspectives are centered in the team processes and decisions. We will reference the importance of youth and family voice at multiple points in this video, but ensuring representation on the team is one starting point for this work. You should also consider other community representatives. Possible team members could include community-based mental health providers, community leaders, or cultural or traditional healing practitioners. It's easy enough to say that school mental health teams should include students, parents, and community members. However, there are many barriers to meaningfully including them in the team process. For example, team meetings often cater to the needs of professionals, with meetings held at the times and locations that they prefer. Meeting language can be full of jargon and hard for newcomers to understand. There can also be significant power dynamics, with professionals intentionally or unintentionally dismissing the perspectives of those with lived rather than professional experience. School and district teams often know how important student and family involvement is, but may not always know where to start and how to best make this partnership happen. Given that, our second recommendation is to actively support youth parents and community members who may be serving on school mental health teams. There are a number of specific recommendations that could support meaningful inclusion of these partners. These include identifying existing youth and family mental health advocacy and navigation organizations in your community and involving them in your efforts. Preparing students and families in advance for what to expect and providing guidance and foundational information prior to each meeting so that they can have a meaningful role. Providing opportunities for students and parents to ask questions and be an active part of decision-making. Ensuring written materials use clear and plain language that is free of jargon. Providing written materials in the first languages of students and families. Involving multiple students and parents in teams to offer broader perspectives and avoid tokenism. Demonstrating equity in partnerships with students and families from groups that have been historically marginalized by amplifying and prioritizing their voices, such as engaging them in leadership positions and sharing decision-making. And finally, providing compensation for team members. Professionals are typically paid to be at the meetings, so why shouldn't that be true for students and parents as well? Provide financial support to youth and parents, including stipends for their time. If needed, you should also provide support for transportation and for childcare. Because the school mental health team does hold significant power and influence, it is critical that all team members develop knowledge and awareness about their own cultural identities, their own biases and assumptions, how culture and language influence the behavior of young people in the classroom, cultural factors that influence the expression of mental health issues, and social determinants that influence the health of the community. Team members should receive ongoing professional development in these areas. In addition to training, team members should be supported to engage in ongoing self-assessment and reflection. In addition to individual level reflection, the team as a whole should consider these issues and how they may influence their collective decision-making. The team should engage in open discussion, asking questions such as, how does oppression show up in our work? In what ways are we causing unintended harm? How is our school contributing to both mental health disparities and well-being? How do we know? And what would school mental health equity look like in our school? Common for school-based mental health teams to align with typical expectations for professional staff, especially dominant culture professional staff. Aligning with more inclusive meeting strategies can not only strengthen the opportunity for authentic engagement of parents or youth or community members, but can also build stronger team dynamics and increase engagement and participation of staff from different cultural backgrounds. We all know what it's like to be part of inefficient or ineffective meetings. Here are some best practices to stay action-oriented and use your time effectively to work smarter with the little time that you have to meet. Best practices for meetings include scheduling and holding regular team meetings, tracking attendance and troubleshooting as needed to ensure consistent attendance, establishing a routine scheduling process, creating and using an agenda and sending it out ahead of time, focusing on making actionable decisions, using meeting time to follow up on the status of action items, accommodating differences in family and community partners' schedules, languages, and physical limitations, providing clear guidance regarding the meeting purpose and the role of team members, and using meeting practices that promote inclusion. Harvard University has produced an inclusive meeting guide with recommendations for holding meetings that are both effective and equitable. Consider strategies to intentionally align with these guidelines, including emphasizing purpose and identity, encouraging meaningful collaboration, and shifting power dynamics. Similarly, consider ways to ensure that meetings are friendly and inviting. Consider what will make all participants feel comfortable and allow everyone the flexibility to participate in ways that work for them. Hold meetings in locations that feel safe and comfortable and provide refreshments. Take time during meetings to reflect as a team regarding team norms and practices used to ensure cultural and linguistic competence. In addition to reflecting about team norms and practices, you take the opportunity to self-assess your team's competence and to establish standards for professional conduct and gender inclusive, equitable, and appropriate language. Our second overarching recommendation is to create universal and culturally responsive systems of support for students. The Comprehensive School Mental Health Framework and the commonly used multi-tiered systems of support, or MTSS framework, delineate between different levels of service, such as identifying students who may need early intervention services or who need targeted interventions. However, the base of this pyramid is really important. At the bottom of the pyramid, we are focusing on universal strategies to support all students. These supports can promote a positive school climate and student engagement within the school, and can also prevent some students from needing to receive more targeted services down the road. This is summed up nicely in this quote from an article that came out earlier this year in the Journal of School Psychology, which says, centering universal Tier 1 intervention following screening is aligned with principles of equity, as it does not view individual students as the primary concern and acknowledges contextual factors that require changes to the system, such as school environments, to foster wellness and address student needs. I want to highlight 3 recommendations in this section. The first recommendation is to develop strategies for promoting a more equitable school climate. The National School Climate Association defines an equitable school climate as one that fosters the full access of students, families, and staff to the following. Number 1, effectively supported high expectations for teaching, learning, and achievement. Number 2, emotionally and physically safe, healthy learning environments for all. Number 3, caring, courageous, self-reflective relationships among and between peers and adults. And 4, multiple culturally responsive pathways to participation that meaningfully enhance academic, social, emotional, civic, and moral development. In promoting a positive and equitable school climate, you may want to start by gathering feedback from students in developmentally appropriate ways to see how they would rate the school climate and whether these ratings vary based on their background. As you consider strategies for building an inclusive school climate, here's a few recommendations for getting started. Consider strategies to promote safety by documenting incidences of bullying or harassment based on race, color, religion, national origin, disability, gender identity, or sexual orientation, and develop strategies to educate students in developmentally appropriate ways to address any bias or stereotypes that you see in those incidences. Expect all students to do well and be alert for messages that may convey lower expectations for some students, such as students whose primary language is not English, students with special needs, students who identify as female, students who are Black, Indigenous, or people of color, or others. Adapt instruction to promote equal opportunities for success, rather than being satisfied with lower performance that can result when learning styles and cultural needs are not being accommodated. Reduce barriers to all extracurricular participation while providing opportunities for engagement that reflects student identities. Depending on the age of students, for example, you may want to offer gay-straight alliances or culturally based student associations. Ensure that parents who want to attend school events have access to childcare or translators. This may include events such as student conferences, performances, or other events. Expect staff to convey a sense of caring in all interactions with students and to offer kindness and flexibility in the classroom and at other school events. Provide training about how trauma impacts brain development and subsequently how it may impact classroom behavior or academic performance, so that educators can recognize this impact when they see it and respond to it appropriately. Consider ways that school or district policies may be experienced differently across different groups of students. Many policies may intentionally or unintentionally introduce bias, such as some dress code policies. One policy area that I want to highlight in particular relates to the importance of developing non-exclusionary discipline practices. In many schools and districts, we see inequitable application of discipline practices, such as out-of-school suspensions or expulsions across racial groups. There is also some important overlap between disciplinary practices and mental health. Some youth with mental health concerns may exhibit behaviors that may be interpreted by educators as disruptive or non-compliant. These students may be subject to disciplinary reactions that result in being removed from the classroom or from the school. These exclusionary discipline practices can be harmful for students, disrupting their education and contributing to negative perceptions or stigma from school staff. The National Center for School Mental Health offers these best practice recommendations related to discipline practices. Collaborate with students and families that are representative of diverse cultural groups and identities to define problem behaviors and appropriate strategies to address them. Implement discipline policies and procedures that are trauma-informed and healing-centered. Implement discipline policies and procedures that are culturally responsive, anti-racist, and promote equity. Train and support school staff in evidence-informed, culturally responsive crisis de-escalation strategies and techniques. Train and support staff in equitable implementation of disciplinary practices in ways that reduce racial or ethnic disproportionality in discipline responses. Integrate restorative practices when addressing emotional and behavioral health crises. And limit involvement of law enforcement in punitive discipline and eliminate exclusionary discipline practices whenever possible. Rather than relying on rigid and exclusionary discipline practices, consider developing compassionate responding approaches. Compassionate responding requires educators to manage their biases, lean into compassionate responding to student behaviors, use a strength-based approach to discussing mental health needs, connect families to culturally responsive supports, and provide equitable supports in the classroom. One core Tier 1 element is the provision of social emotional learning. The Collaborative for Academic, Social, and Emotional Learning, or CASEL, defines social and emotional learning, or SEL, as the process through which all young people and adults acquire and apply the knowledge, skills, and attitudes to develop healthy identities, manage emotions, achieve personal and collective goals, feel and show empathy for others, establish and maintain supportive relationships, and make responsible and caring decisions. SEL is a core element of Tier 1 support and can help address various forms of inequity and empower young people and adults to co-create thriving schools and contribute to safe, healthy, and just communities. The National Center for School Mental Health promotes these best practice standards for social emotional learning. Develop a clear plan for assessing current SEL skills among students as baseline data and to inform your team's plan for further improvement. Incorporate SEL skills that promote anti-racism and equity. As a team with school staff, community partners, parents, and students, identify current activities or programs that support SEL skill development in the school and assess to what degree they are being implemented with fidelity and achieving desired outcomes. As a team with school staff, parents, and students, identify, select, or adapt SEL skill development practices or programs that meet the needs and strengths of the students at your school. Monitor implementation of SEL skill development activities for fidelity, feasibility, and acceptability to school staff and students. Ensure SEL skill development activities are developed with and communicated by students, parents, and members of the school community. And reassess SEL skill development on a routine basis to monitor progress and inform feedback to school staff and team planning for ongoing activities. CASEL also promotes thinking about SEL in ways that help to transform systems and promote equity explicitly. Transformative SEL is a form of SEL implementation where young people and adults build strong, respectful, and lasting relationships to engage in co-learning. It facilitates critical examination of individual and contextual factors that contribute to inequities and collaborative solutions that lead to personal, community, and societal well-being. Through transformative SEL, students and adults develop social and emotional skills needed for school and community engagement, with a focus on rights and responsibilities for creating learning environments that are caring and just. Transformative SEL grew out of developmental science and research on students' engagement, well-being, academic achievement, and long-term success. But in practice, there are currently limited options for evidence-based programs and implementation models for transformative SEL. CASEL is continuing to partner with different organizations to try to develop more models within this transformative SEL framework. So it would be worth checking back with their website periodically to see what new resources are being developed. Our third overarching recommendation is to provide mental health supports that are accessible, culturally responsive, and aligned with the needs of students. As part of a comprehensive school-based mental health framework, you may be providing direct services to students who need more individualized support. This includes services at Tier 2 that may be offered to students with emerging needs or students at risk of developing needs, and services at Tier 3 that are offered to students with identified mental health concerns. Decisions about what services to offer should be made by a diverse team that represents varying perspectives, including youth, parents, community members, and others. These partners can join in the selection process with appropriate school staff, such as mental health providers, school administrators, teachers, and others. If the selection process is being done by that school mental health team that we talked about earlier, and you have all of these perspectives included in the team, then you may be all set. But if you have a standalone process, such as an intervention selection team, you'll want to make sure that that representation is carried over and really centered in the selection process. Second, be mindful of cultural and linguistic considerations when selecting a program. It can be complicated to find the right evidence-based program, especially when serving a diverse group of youth. It is important, however, to be mindful about cultural and linguistic factors when selecting an approach. Consider the following issues when making a recommendation about offering school-based services or when identifying community supports that you may want to make referrals to. Do the services include family or natural supports? Is the location or setting comfortable for the young person and their caregivers? Might a non-clinical setting, such as a community center or a faith-based setting, be more appropriate? Are services provided by mental or behavioral health providers, peers, spiritual leaders, elders, cultural brokers, or someone else? Do young people and their families understand language, idioms, and words used? Does the program use culturally relevant metaphors or sayings for the specific group to be served? Does the intervention consider the culture and lived experience of the student? Does the intervention consider the cultural and social characteristics of the student's family and community? Is the intervention negotiated with the student and his or her family to ensure that both the student and the school's interests are addressed? Does the intervention have the capacity to fulfill the intended or desired outcomes? Is there evidence that the intervention works for the communities that you will be serving? These are important criteria to strive for or things to look at. The reality is that there is still a shortage of evidence-based interactions that may align with all of these criteria and fit the needs of your specific school community. If that is what you find, you will need to make some decisions about how best to move forward, and that leads us to the third recommendation. Our third recommendation is to use student, family, and community input to adapt service models as needed. Some evidence-based mental health interventions place primary emphasis on the importance of maintaining fidelity or implementing the curriculum or model exactly as it was developed. If you feel that the existing models do not meet your needs, you may need to consider making adaptations to existing services. In other words, you may need to discuss the possibility of sacrificing fidelity. If fidelity to the model means delivering services in ways that are not appropriate for your population. In planning these adaptations, consult with cultural liaisons, students, families, and the service model developers to determine whether modifications are possible and the potential impact of those modifications on the effectiveness of the intervention. If you do want to modify a service approach, you might want to consider piloting it with a small group before expanding services. Gather feedback from participants and measure the impact of services, and use that information to guide potential expansion. Our fourth overall recommendation is to build the knowledge, skills, and capacity of all school staff to advance equity. As we've mentioned, school-based mental health and student wellness is not siloed into one aspect of the school environment. All staff have a role to play in promotion of equity, and they need to be prepared to do so. We've talked already about ways that school staff are instrumental in promoting school climate and student well-being. Some school staff, such as classroom teachers, may also be responsible for things such as screening youth to determine potential needs for emotional or mental health support. Teachers themselves may have very different cultural backgrounds and experiences, and it is common to see variation in how they are engaging with students and interpreting student behaviors and needs. This leads to our first recommendation in this area, which is to provide training to all staff to support their cultural sensitivity. It is important that all staff, especially those that may be interacting most closely with students or participating in mental health screenings, receive the training and support needed to reflect on their emotional responses, prejudices or biases, and cultural expectations that may influence their interpretation of student behaviors. Students may display a wide variety of behaviors that are actually pretty adaptive when viewed within the lens of gender, cultural values, or their personal experiences. However, these behaviors may be viewed as problematic through a dominant cultural lens and may result in youth being referred for services that may not actually be warranted. It may also result in youth who need services being missed in that screening process. While building some cultural knowledge or understanding can take place through trainings, we know that training is not sufficient when it comes to deeper reflection and meaningful practice change. It is also important to provide ongoing coaching and consultation or other supports to encourage deeper awareness building and skill building. Some best practices from the National Center for School Mental Health include providing interactive training with opportunities for skills practice, role playing, and action planning, providing ongoing support for implementation with regular coaching, consultation, or supervision that includes skills practice, role playing, and corrective feedback, as well as fidelity monitoring and feedback processes. And ensure that all trainings integrate principles of cultural responsiveness, anti-racism, and equity. Our second recommendation in this section is that you assess and support staff well-being. Teachers are experiencing really high levels of stress and burnout. Large class sizes, often including many students with significant social, emotional, or behavioral needs, contributes to this stress. Many teachers report limited resources, poor physical space, high workload, low pay, mounting paperwork, staffing shortages, concerns about school violence, and high levels of responsibility for student success as reasons for their stress. Stress may be especially high for school staff who live under systemic inequities themselves. School staff well-being is important in its own right, but we're talking about it here because it also directly impacts students. Staff who are stressed demonstrate more negative interactions with students, including greater frustration and more reliance on punitive discipline strategies. They can be less patient and more sarcastic with students. These types of interactions can impact students' feelings of the school as having a positive climate or being a safe place for them to be. Importantly, there is also research that shows that when we are stressed, we are more strongly influenced by implicit bias and stereotypes in our decision-making. We have another video in this series that outlines a process for promoting school staff wellness, and I do not want to repeat all of that here. However, there are a few initial recommendations that I would offer in promoting staff well-being. First, it is important to remember that this is not about self-care. While self-care is important for all of us, in this context, we need to focus on addressing the underlying causes of school staff stress. Consider assessing staff well-being to determine what the greatest contributing factors are in your school and develop strategies designed to reduce them. Focus on strategies to not only promote individual staff well-being, but also collective and organizational well-being. This may involve changing norms, policies, practices, and infrastructure to support staff. With all of the other demands taking place in the school environment, it can be hard to create space and a process for promoting staff well-being. However, research suggests that staff who are feeling highly stressed and burned out will not be effective in engaging in the reflection and practice change necessary to foster greater equity in school settings in general, and in our school-based mental health systems in particular. The next set of recommendations relate to your use of data. A comprehensive school-based mental health system should infuse data throughout the system. Data should be used to identify student needs and strengths, screen specific students for services, assess overall school climate, and measure the impact of services that are provided. There's a lot of power in this data, guiding what services are provided and who receives them. However, we know that inequities can be systemically embedded into data collection procedures, and it's important that data represents all students and is collected using culturally and linguistically appropriate strategies. Because of the power that is centered in this data, we have 7 recommendations in this area for promoting equity. First, it is important to explicitly identify and name equity-related goals and measure your success in meeting them. Stating goals makes your efforts in this area transparent and visible to your team and your stakeholders, as well as to students and families. Understanding your progress towards these goals will help identify strategies that are successful and places where you may be facing challenges. It can also inform strategies for moving through these challenges. Equity should be incorporated into the building blocks of your evaluation, such as your program logic model and evaluation goals, the tools and methodologies you use to gather information, the interpretation of results, the development of recommendations, and the strategies for disseminating the results. The second recommendation is to use culturally and linguistically appropriate data collection tools. All information that is collected for your school-based mental health system, such as your needs assessment, screening, or impact evaluation, should use validated, culturally responsive tools that reflect valued outcomes and are appropriate to your student population and in the first languages of students and families. Ideally, we want to use tools that incorporate social determinants of health, protective factors and assets, trauma exposure, and traumatic stress. Consider whether tools have been developed for and within populations that reflect your school community, and whether the validity and reliability of the tool has been assessed with these populations. Make forms comfortable and appropriate, including the opportunity for youth to self-identify race and preferred pronouns in all data collection. Most existing tools were developed through a white dominant lens, and there are a few options for valid and reliable tools that have been found effective across diverse populations. Before selecting a data collection tool or approach, get feedback from students, families, and community members. They can help identify the strengths and limitations of proposed approaches and offer recommendations for improvement. If your data collection tools do not align with these values, partner and consult with cultural liaisons, students, families, and instrument developers to determine what concepts or phrasing may be problematic or lead to misunderstandings. Consider whether changes in item wording or scoring could help alleviate these concerns. If you need to use a tool that does not align with these criteria, be transparent about these limitations when discussing the findings with others or when interpreting the results for your district or school use. Our third recommendation is to disaggregate data and examine disproportionalities and disparities. When using data, it is simplest to look at things like mental health need or ratings of school climate for your entire school population as a whole. However, when we do so, we miss variation that may be present across different groups of students. A key recommendation is to collect, analyze, and use data on disproportionalities and disparities to continuously inform school practices. Disaggregating data involves examining information for different subgroups of students, allowing you to see potential disproportionalities or disparities in the results. Your ability to meaningfully disaggregate data will depend on the size of each of the groups that you're looking at. Depending on your specific school population, you may want to disaggregate data based on race or ethnicity, immigrant or refugee status, age group, grade, gender identity, sexual orientation, economic status, or other factors. You'll want to make sure that the data collection tools include these cultural or linguistic identifiers so that you can use the information later to explore disparities. If you do find disparities in data across various subgroups of students, be aware that there are many different factors that can contribute to these differences. Often differences can be traced to other systemic differences in what students experience or how they are treated. You also need to be aware of your own perspectives and opinions to ensure that you are not inadvertently interpreting differences through a lens of implicit bias. The fourth recommendation is to examine and reduce bias in existing tracking systems. Relying on data that is as objective as possible can minimize the role that assumptions and implicit bias can play in making determinations about student mental health needs. There are a variety of data sources that can help you examine your school-based mental health system, such as mental health screenings and assessments, school climate surveys, grades, attendance records, test scores, office referrals, suspension and expulsion data, behavioral observations, crisis incidents, etc. It is important to remember that bias can be built into many of these existing school measures. For example, there may be differences in test scores that relate to financial access to educational opportunities or to the cultural relevance of the test items. There may be differences in how behavioral situations are managed based on student race or ethnicity. The best way to uncover bias is by listening to the experiences and perspectives of your community. Talk to students, parents, school staff, cultural liaisons, and community members in these conversations. Address and resolve family concerns regarding data sharing. Students and families from cultural backgrounds other than the dominant group might experience distrust or fear about sharing information, as information collected by schools and other prominent systems have sometimes been used in ways that were harmful. Data collection and storage systems need to be established to protect the interests of students and families. It is important that students and families have clear information about what is being collected, why it is being collected, and how it will be used. Information should be shared regarding this in multiple formats and in the languages spoken by your youth and families. Families need to understand how information will be used and who will have access to it. This includes providing clear information about whether information submitted by students will be shared with parents. This may be especially important if students will be disclosing information that they may want to keep confidential, such as information about their sexual orientation or their gender identity. There should be clear parent consent and youth assent processes where students and families have opportunities to consent or to opt out of data collection activities. Consent forms should be available in parents' preferred languages, with opportunities for them to ask questions or seek clarification prior to completing them. Not all information that is submitted needs to be identifiable. That is, we do not need to trace results back to an individual student. We do need this information sometimes, such as for screening, so that we can connect students to appropriate supports. However, other information like needs assessment data, school climate surveys, or impact assessments can typically be collected anonymously. Do not require students to share their names unless you really need the information. Sixth, increase representation by making it easy for people to share information. When we're collecting information from students, there are a variety of reasons why some people may be excluded. There may be language barriers or confusion about data collection approaches. Some students may be absent when we are collecting information. It's important to identify reasons why we may be leaving people out and develop strategies to make sure that all voices have the chance to be heard. Consider strategies such as providing multiple opportunities to participate and conduct outreach to students who may have missed the opportunity the first time. Provide clear written and oral information about the data collection in advance and during the administration, including using interpreters or cultural brokers for support. When appropriate, consider collecting information more than one way, such as surveys, interviews, or focus groups. Offering multiple strategies can make it easier to engage students with different learning styles and different levels of comfort regarding written versus spoken feedback. Our final recommendation in this section is to share information and use data to guide systems and policy change. One of the easiest ways to have families or community members lose trust in you is to gather feedback and then they never hear about it again. To strengthen partnerships with key stakeholders, share the findings from needs assessments or impact measurement. Sharing your information promotes trust and transparency, helps support consensus building, and allows partners to also use your learnings to strengthen their services or supports. To support these goals, commit to sharing your findings, even if they're negative. Develop recommendations for stakeholders to use the findings to support action. Use a variety of strategies for disseminating findings. Share your findings in plain and clear language that can be understood by stakeholders, partners, and community members. And share lessons learned to help others concerned with strengthening comprehensive and equitable approaches to school mental health. In addition to sharing your information, be sure to thoughtfully review the implications of information that you learn through your needs assessment, screening, or impact efforts. This information is critical in developing a comprehensive array of services and matching students to the most appropriate services. Data can play an especially critical role in your equity efforts. As you use your data to strengthen policy, practice, and systems in your school, consider the implications for equity promotion. Your data can help you align services with the needs of all students, reduce potential bias in information sources, and identify potential disparities in service access or outcomes. Our final recommendation is to build authentic community partnerships. Schools do not operate in isolation, but rather are part of a larger community. Partnerships between the schools and this broader community can support your school-based mental health system. Community partners can provide valuable insights regarding student and family needs and assets. They can also share feedback to help you improve the quality of services or to design stronger policies or practices. Community agencies are also part of the array of services and supports available to students and families, and a strong understanding of community offerings could help you identify services that address student needs. It is important, however, that these relationships be based on principles of partnership. Often, community partners are invited to the table to support school needs only. It is important to establish relationships with community agencies or individuals that are transparent, authentic, and mutually beneficial. We have 3 recommendations in this area. Our first recommendation is to establish relationships and agreements with community partners. When partnering with community agencies, be as explicit and transparent in expectation setting as you can. I want to highlight a few best practice recommendations from the National Center for School Mental Health. First, establish communication mechanisms such as team meetings, email, or conference calls to ensure ongoing and effective communication between school staff and community partners. Note the inclusion of the word ongoing. Be intentional about making sure that you are maintaining ongoing communication, rather than just going to the community agencies when you need something from them. Your ongoing communication should emphasize opportunities for collaboration and information sharing. Use memoranda of understanding or other agreements to detail the terms of the partnership. What services will be provided? By whom? When? Where? How? When you are establishing more formal agreements, be sure that you have documented expectations in writing so that all partners are clear about these expectations and agreements. If student information will be collected by the schools and shared with community partners, or collected by community partners and shared with the schools, use data sharing agreements. These agreements will allow for accessing and sharing information to inform needed services and supports and the impact of partnership activities. The second recommendation is to consider identifying representatives from diverse community groups who can serve as cultural brokers. Cultural brokers are individuals from the community who can serve as a bridge or a liaison between an organization and people of different cultural backgrounds. Cultural brokers can be engaged to help in a variety of ways, such as serving on school mental health teams, participating in information gathering efforts, reviewing and selecting data collection instruments or intervention approaches, developing engagement opportunities for students and families, etc. Cultural brokers do not need to be mental health professionals. They could be caregivers or family members with lived experience navigating the school or community health system, or they could play other roles in the community. Cultural brokers should be paid for their work serving as a liaison between the school and the community. You may find individuals who want to serve as a broker in various stakeholder groups in the community, such as parent advocacy groups, community mental health agencies, faith-based organizations, and other settings. Our third and final recommendation is to develop resource maps with broad representation of community agencies. For a variety of reasons, it's common for schools and school districts not to have strategically mapped or have a clear listing of the array of services available for students and families. As a result, many students, families, and staff are not aware of services and supports that are available within the surrounding community. Even when they have some awareness, staff and parents may not know how to actually connect students to resources. One way to improve this access to community services and supports is to start by developing a resource map. A resource map compiles information about available services, including what they provide, who is eligible to receive services, and procedures for connecting with services. If this is an area that you prioritize for immediate action, another video in this series walks through the steps of creating a resource map. Resource maps are sometimes focused only on services and supports offered through the schools themselves. However, completing a community-level resource map can help you identify valuable local resources, improve awareness of and access to services, enhance communication and collaboration with community partners, and inform strategies for developing deeper partnerships with these community resources. It can be helpful to identify not only mental health supports, but other services that may be helpful for youth and families, such as tutoring services, housing programs, or cultural healing services. Once you have compiled this information, share it with families and with staff who are assessing student needs and referring students for services. Okay, this video covered a lot of ground. We know that. And again, I wouldn't expect any school or district to try to take on all of those recommendations at once. Equity is complex and multifaceted, and these efforts are going to take some time. It will also take careful planning and courage, as systems simply do not become more equitable just because we want them to be. If you are striving to promote equity through your school-based mental health work, engage your partners in this conversation, including students, parents, staff, and community members. Work to identify goals related to equity and identify the specific recommendations and strategies that most closely align with those goals. Monitor your progress, make changes as needed, learn from your successes, and learn from your missteps. Over time, you can expand this work so that equity is infused throughout your school-based mental health system. This work is so important for students and families, and we know it's not easy. Work towards these shared understandings and take bold steps to change policies and systems. These efforts matter and can have a powerful impact on creating systems that are more effective for everyone and for dismantling systems that have histories of embedded bias. I wish you the greatest perseverance and success in these efforts. Thank you.